The best way to keep your heart healthy is to, first of all, commit to regular activity. We see many patients in the course of our work who have sort of become inactive and sedentary, some of it just by losing their will, but many times patients may have other conditions that keep them from being active, but we find that once you lose the ability to be active, then it starts a cascade down a road that we don't like to see. But another major component would be recognizing your risk for developing heart disease. Particularly, we see a high risk of cardiovascular disease in patients who have hypertension or high blood pressure, diabetics or people with uncontrolled blood sugar. Other common risk factors would be high cholesterol, the sedentary lifestyle that we just mentioned, and cigarette smoking. And so if we can modify all of those key areas, then we can greatly and drastically reduce the risk for heart disease. And so it's most important to recognize your risk. We see lots of patients who may come in with a vascular event such as a heart attack or a stroke who have had these chronic medical conditions for years that have been out of control or poorly controlled. If we really appreciate that controlling those risk factors is key in preventing these events, then I think we've made some strides. Personally, living well for me is a commitment to regular exercise. What I do is I try to exercise on most days of the week, and that's I mix up strength training with cardio exercise, aerobic exercise, either by running or participation in a boot camp, which may not be for everyone, but just the point that I'd like to make is just that some regular activity is going to be key in preventing most cardiovascular related illnesses.